on behalf of Center for Metabolic Surgery, which is at Wockhardt Hospital, and I'm going to talk about what the physician should know about recommended medicines in bariatric patients. So these are basically in three categories. The supplements that are typically given to any bariatric patient after surgery to ensure that they are nutritionally well balanced, because the meal size is very small. And so this is I'll just spend a few minutes. Weight loss medicines, already Dr. Pardiwala has discussed in detail, so I'll not be covering that. And then how do you manage comorbidities after bariatric surgery, because there are multiple issues involved. So as far as supplements are concerned, why supplements are required after surgery? Basically for these three reasons, that most of the population have pre-existing deficiencies. We know how almost 80% of Indian population has vitamin D deficiency. A very large percentage of population have vitamin B12 deficiency, and likewise. And generally, these are the deficiencies we check. We don't check for hundreds of them, manganese, magnesium, selenium, zinc. So we presume if there are more than one deficiency that we find, that means person has multivitamin and multimineral deficiency, and all of them should be corrected as a broad umbrella. Then there is surgical impact. So if we do a surgery where we are operating only on a stomach, like a sleeve gastrectomy, then the supplement dose requirement is less because there is no malabsorption involved. But if you are doing a surgery which is a bypass, then certainly the requirement is higher. And third thing is diet related. There are people who are vegetarian, there are people who are vegan, and after bariatric surgery, their requirements are different than, let's say, somebody who is taking a balanced diet which has enough protein in it and enough calcium products in it. So we'll briefly talk about it, so give you an idea. So most of the time, pre-operative workup, besides routine tests that are done for any general surgery, we usually get their ferritin level done besides non-routine iron workup. We always get a B12, vitamin D3, and parathyroid hormone done. And we measure their serum proteins and albumin globulin ratio. These are important because this shows what kind of deficiencies they have. And if there are deficiencies, and if patient has time, they are local patients and they want to get a surgery done a month later or 2 months later, then we can start correction of these deficiencies well in advance before surgery. Many times it happens that patient just landed in Mumbai and we operate them. So we get these deficiencies assessed and we do the correction accordingly. We factor in that they already have deficiency and correct them. And these supplements basically involve 2 or 3 groups. One are the micronutrients, which are vitamins and minerals, and there are macronutrients like proteins, carbohydrates, and fat. So we are basically supplementing proteins. And then we give bile salts to our patients, and I'll just show you why we do that. Now, bile salts are given because in any weight loss, it's not related to only bariatric. Any weight loss leads to processing of fat in the body, and there are free fatty acids which are processed in the liver, and there is increased cholesterol concentration in the bile. So the bile becomes more lithogenic, or it forms more stones with weight loss. And if we give them bile salts for 6 months, then this lithogenicity reduces to about 2%. That means if 100 patients are given this, only 2% are likely to form gallstones because of weight loss, and which is a substantial benefit. And this is required only for first 6 months. After 6 months, we get their ultrasound done, and if there are no gallstones, we stop the bile salts. So this is how we manage, and these are ursodeoxycholic acid, 600 milligram, given twice daily, usually after meals, to avoid the gastritis. Then this is discussed in detail about endocrine impact. I'll just show you one slide about it, that after surgery, all patients have reduced insulin resistance. and thus the body is producing less insulin. So because pancreas get rest. So before surgery, their insulin levels may be 20, 24, 30, 70. And after surgery, because the insulin resistance is less, gradually the insulin requirement goes down and insulin production goes down. And the pancreas is able to protect its reserve. And then similarly, there is a reduced ghrelin level. Ghrelin is secreted usually from proximal bowel, especially stomach. And thus thus patients after bariatric surgery have low hunger compared to a diet where the ghrelin level goes up and the person is hungry all the time when they go on a diet. And the third major endocrine impact is on the GLP-1 hormone, which is secreted from the distal bowel, let's say that's distal small bowel, ileum and distal jejunum. And this all the physicians know, this is responsible for better glycemic control. There are many other hormones, but I wanted to make it compact and we can discuss them in question answers if you wish to. Now, as far as medical management after surgery is concerned, so if a person had diabetes before surgery and is after surgery, the sugars are fluctuating in the initial 1 or 2 months, then it's better to use biguanides and sulfonylureas. And the reason is that if we continue to give them insulin, the normal glycemic level or euglycemic level takes time to be achieved. While with this is more experience-based, there are no studies done on this, but this is what has been realized, that these two drugs help. Then antihypertensive medication should be continued after surgery, and only a family physician or a physician should stop it under supervision. Most of the time we have realized that patients start having postural hypotension if they continue with the antihypertensive for very long. And this postural hypotension can be reduced or avoided if the antihypertensive medication is reduced or stopped by the physician. So please watch out for postural hypotension in your patients, and you can help them directly. These are not hypoglycemia. These are mostly postural hypertension. Then we know that thyroid medications are generally not stopped after bariatric surgery, but as the weight of the patient goes down, the thyroxine requirement goes down, and it's a good idea to monitor their TSH levels. And as it goes down, you can probably reduce the thyroxine supplementation. Sorry. Similarly, for gout, we avoid Zyloric in these patients because we do not want severe gastritis or other issues. So it's a good idea to monitor their uric acid because we are supplementing them with proteins, and to start Fabustat to control the uric acid levels. And believe me, none of the patient requires protein to be stopped, because after surgery, we are replacing the proteins which they normally get from the diet. So please don't stop proteins of bariatric patients. If the uric acid levels are very high, maybe you can reduce the quantity of protein for a few days, start Fabustat simultaneously, and the moment it comes within the range of 6 or below, you can increase the protein and continue with Fabustat. And once the uric acid has come down substantially, you can stop the Fabustat. So proteins are required and they should be given. Now, a controversial issue is lipid-lowering drugs like statins. Now, post-bariatric surgery, it is known that cholesterol levels become normal, triglyceride levels become normal, but it takes at least 1 year, and this is because there's a processing going on. So it's a good idea that we don't expose our patients to cardiac risk, and it's a good idea to continue with the drugs that you are giving before the surgery for at least 1 year. And generally 1 year later, the cholesterol and triglycerides come within normal range, and then you can definitely, and you should stop these drugs at that time, 1 to 1.5 years after surgery. Friends, it's important, and it's to remember that after bariatric surgery, if a diabetic patient, if they get an infection, the sugars can go up. So patient may tell you, I had a bariatric surgery and I don't have diabetes, But please ask them that, did you have diabetes before surgery? Even if they are not on medication, but if they have any pneumonia or urinary tract infection, it's a good idea to start them on insulin, check their blood sugar. And similarly, patients may have low blood sugar after bariatric surgery because all of them have excellent glycemic control. So we need to keep a watch on that also. Please do not stop supplements of a bariatric patient. So if they are admitted or have any other disease, either continue in an intravenous form or continue the oral supplements. Supplements are extremely important, and it's a good idea not to change the supplements prescribed by a bariatric program, because we are our dietitian is able to identify the supplement RDAs of various vitamins and minerals and give a supplement accordingly, which are not the normal supplement. These are bariatric supplements. Then for other analgesics, other medication, antibiotics, usually 3 months after surgery, they can be prescribed. It's not necessary to avoid them, but obviously combination analgesics should be avoided so that we don't have gastritis or gastric perforations. Whether other procedures, other surgeries, deliveries can be done after bariatric surgery, certainly there is no limitation. A lot of our patients who travel from overseas have a second surgery 7 days after bariatric surgery. So anytime after 7 days to a month later, people have like a knee replacement after bariatric surgery after 1 week. So this is all possible, and do not worry about this. And this is a small word of caution for you. Now, bariatric patients may get constipated because they are eating a very small meal, and the intestine absorbs most of the nutrition from there, so there is hardly anything left to form the bulk. So it's a good idea to offer them whole grains, so it has some fibers, vegetables and fruits, but still the focus is on the protein, so they really do not get enough. So now giving them isabgol doesn't help, because isabgol is a bulk former and it's very difficult to be consumed by a bariatric patient. So nowadays we have soluble fibers available. I'm sure you are aware of it, like Cremalex or Nutrilite fiber, which is transparent, which mix in the water, and it's so easy to drink, and it doesn't stain in the stomach, so it doesn't form a bulk there. So it forms a bulk further down, and the person is able to eat a bariatric diet after this. A patient should be encouraged to continue regular exercises because that helps in their constipation. And if they are constipated, do not hesitate to prescribe laxatives, because usually constipations are there for about 3 to 6 months at the most, and non-habit forming laxatives can certainly be used. Another thing that physicians should know, that there is a term called dysgeusia and dysosmia, which are disorder of taste and smell. So patients may complain that they don't like rice, or they don't like chicken, or they don't like water, or they don't like something. It is a real problem. It's not something in about 5 to 10% of bariatric patients, not in all the patients. There may be patients who have dysosmia, that they find a smell of, let's say, garlic beer in the house not acceptable, which they were loving before, or a smell of anything being cooked. And this is simply a matter of time. It is not long-lasting. They are self-limiting. And this is probably because the ghrelin affecting the olfactory hormones. There is a study being done on this. So it's a good idea to rule out deficiency of zinc, copper, and nickel, which may contribute for this. And usually avoiding these particular stimulus is enough for about 1 to 3 months, and then the person will be able to consume them again. A quick word about what is a standard advice of supplementation after bariatric surgery. So proteins about 1 gram per kilogram of ideal weight is enough. Multivitamins like 1 to 2 times daily, depending on the which kind of multivitamin we are using. Calcium citrate, calcium in citrate form or fumarate form with vitamin D, about 1000 milligram of calcium citrate a day. Vitamin B12, in India, we get the sublingual tablet, very good. They don't need injectable vitamin B12. a 1500 microgram twice weekly is more than enough for sublingual tablet. And similarly, iron in a ferrous sulfate form, ferrous sulfate form is better. And similarly, the bile salts, as I mentioned, 600 milligram twice daily for 6 months is enough. And it's a good idea that these people are monitored for their vitamins and my macronutrients. So these are the tests which we usually advise them to get done at 6 months. Ultrasound is done only at 6 months, not thereafter. But other tests are done on an annual basis thereafter to make sure that they are having no deficiencies. And I tell you, almost 19% of our patients have no deficiencies after bariatric surgery. All of them had deficiency before surgery, but the nutrition status improves after bariatric surgery. So, to give you a brief mnemonic, weapons of bariatric surgery with a different spelling is water, exercise, proteins, no snacking, and supplements. It's very easy for patients to remember, and you can tell them to follow this. So, friends, surgery is not the end. It's a beginning of a weight loss journey, a beginning of a healthy journey for patients. And please be a part of it so that your patients feel good about their health. So thank you so much.